Hi friends, good morning. This is 2nd May 2022. I'm Dr. Manish Mahajan, consultant neurologist from Gurgaon and neuroimmunology. So I'm here for the morning bite in continuation with the My Health, My Responsibility and the month of May, that is the MS month or the Multiple Sclerosis month. So I'm here to continue what we discussed yesterday, that what is the meaning of MS, that is multiple sclerosis, and a broad thing that it is a chronic immune mediated demyelinating neurological disorder affecting central nervous system. Now yesterday we discussed what is myelin, so you can go back to my previous video and just have a look, and this is going to be a series of awareness about multiple sclerosis. So as I told you yesterday, that this is a disease of the young and it affects the central nervous system, which includes brain, spinal cord and optic nerves, because they share the same types of neurons and the same types of outer coverings which have the same types of proteins. So they are vulnerable to similar types of insults from the body, and in multiple sclerosis and related disorders, other immunological disorders where your body immunity becomes abnormally active, and then we don't yet know, that's humble submission, the science doesn't know what triggers this abnormal immunity. There are certain hypotheses, viral hypotheses, that certain viruses do trigger them, but not yet established. And the point is that once they get activated, they can attack the outer covering of the nerve cells, that is the myelin. Now this sheath, once gets damaged, they produce symptoms according to the site of the involvement of these three components of the central nervous system. For public at large, I don't think that the details of the damage to the myelin sheath and then secondary damage to the nerve processes called axons is important. So what's most important to understand is when to suspect multiple sclerosis. That means what are the common symptoms and where one should suspect that multiple sclerosis workup is required, and there is a need to look at other differentials or other causes for similar types of symptoms. Now the most common symptom with which people come to us is loss of vision or diminution of vision from one eye. That is what we call as optic neuritis. So it's a diminution of vision which happens over some hours, and then this starts from the central part of the vision, and though there are certain other patterns, but that's the most common. This is associated with painful eye movements, and this diminution of vision, now sometimes this improves on its own over the coming few days, or sometimes most of the times when people go to the ophthalmologist for this problem, they suspect rightly multiple sclerosis and then start the workup, and for at least this episode people are administered IV steroids, and then this expedites the recovery. So what happens is that this optic neuritis, this can resolve but usually gets expedited, and there is some evidence that it can get better. The final outcome can be slightly better than if the person doesn't receive the steroids. Now what are the characteristics of optic neuritis? That these can usually in multiple sclerosis, it's on the one side, that it involves one side. It can involve the same side in the another attack, or it can go to the other side. Now that's for the optic nerve, and usually the ophthalmologist will not be able to see anything major abnormality in the eye, or even in the back of the eye, what we call as the optic fundus or the retina, and then they suspect that this is something involving the optic pathway beyond the eye. So that is something to be complete, what we call as retrobulbar optic neuritis. Now there can be other attacks which can come together. There's some other symptoms which can come together, or they can be spaced in time. So this is something which we call as dissemination in time and space. Now if the same symptom comes or another symptom comes after a gap of at least a month, so then we something called as dissemination in time. If another symptom which is from a different location, like where we talked about eye, now if we talk about other symptoms, they appear after even at the same time, then this is called as dissemination in space. And obviously they will also contribute to dissemination in time if they happen at a different time frame. The other symptoms, now the most common symptom after this is imbalance while walking. Now that's all because of the fibers or the area of the brain which controls our balance. So there is the tendency while to reel to one side, to sway to one side on standing, reel to one side on walking, and there will be difficult maintaining the balance while walking, or sometimes even hand tremors, and your tongue can also be unstable. Another common feature is the involvement of half of the body in the form of numbness, and obviously very prominent, and we all know about weakness, or what we call as the paralysis of one or one half of the body. Now the other symptoms because of the spinal cord involvement can be again some tonic pains and spasms in one limb, bladder involvement, that is now the bladder can be involved isolatedly, that is in the form of urgency, or it can be associated with weakness of both the lower limbs. Now all of these symptoms, it's not that this is every time because of multiple sclerosis. So if someone has a diminution of vision from one eye, then at some other time they give history that there is imbalance issues, or there is something what we call as recurrent optic neuritis, then there is the problem of balance, weakness of one or both the limbs on one side, or both the lower limbs, with or without bladder issues. Now these symptoms suggesting central nervous system involvement in a young patient, and which shows the characteristic of dissemination in time and space, are indicators of what we call as multiple sclerosis. So here is somewhere we should suspect multiple sclerosis. Now we will talk tomorrow about the other non-motor symptoms, as well as how to establish the diagnosis of MS further on. So goodbye for today. This video is longer but very important to understand. So with this, I continue on the 4th day of my physical activity and 3rd day of HDR 100-day walk and run challenge. So goodbye for today. Have a nice day. Bye bye. Thank you.